Well, 'tis the season to be jolly, but also for some unwanted things like viral infections, flus, and colds. Dr. Nooristani joins me now from Balance 7. He's here for his monthly health check-in. I always love these conversations. Doctor, welcome back to the show.
Well, thank you for having me. I'm looking forward to this conversation and educating the audience. It's the flu season, so I'm excited about it.
I feel like we're coming into this flu season with added information, having, been through the pandemic, washed our hands a lot, worn masks like we did. And now here we are talking about things like influenza and RSV.
Yes, I mean, the flu season is in full swing. It starts with October and ends in March. December is where it peaks. And we are seeing now in the hospital a significant amount of patients with RSV as well as influenza.
Yeah, it's interesting. I think there's a lot of myths when it comes to RSV. People are saying that it's definitely more vulnerable for the younger and older populations. What are you seeing this year?
Well, I mean, it's just kind of you're absolutely right. Kids and usually adult population gets it, and they get really sick. But I'm really surprised this year. Everybody's getting it. I'm seeing all ages at the hospital actually. I mean, just from just being kid and all the way to older, but also people in their 30s and 40s. So I think this year is a tiny bit different than prior year for RSV and influenza. So just a little surprised about it nonetheless.
Can you give us kind of the basics on viral infections? I think sometimes we share information about how to keep ourselves healthy and we kind of maybe forget the medical background behind all of this. How can we avoid viral infections this holiday season?
Viruses are spread through droplet, and so droplet precaution, wearing simple things like wearing your mask in a crowded places. If somebody's sick at home, make sure they wear masks so they don't spread it. Wash your hands frequently. Make sure you take your vitamins and to stay healthy. Exercise, keep your immune at top level because there's really not many medication that we can give for viral infection that could take care of them. It has to go through their process, and it usually takes it somewhere between 3 days to 10 days to get over them. So stay hydrated and take over-the-counter medication just to just kind of relieve the symptoms. The runny nose, the fever, the headache, the chills, things of that nature. So at least you're comfortable with.
Doctor, I think it's interesting you mentioned masks, and I think we all look at masks completely differently. Over the past 3 years, we've gotten to know masks very well. As many of us travel, get on airplanes during the holiday season, do you think it still might be wise to choose to wear a mask?
Absolutely, especially now. I mean, we don't see as much COVID as now, but RSV and influenza is there. And this droplet, especially in crowded places, so you're bound to, you're bound to catch it if somebody's sick in the plane. Now, depending on what kind of person you are as far as your health concern, are you a high risk individual? Are you mid risk or low risk? For high risk individual, there's no question about it. You got to protect yourself, avoid crowded places as much as possible, and wear your mask because that you want to protect yourself because your immune system is down and its ability to fight is so limited. But everybody else, as I said, precaution, precaution, precaution. So if it doesn't hurt you to wear a mask.
Well, it just takes a few moments, doesn't it, to catch a bug. And so, if you can make it through the holiday season without getting anything, boy, will you be on top. By the way, I'm staying hydrated. I'm drinking my peppermint tea. Doctor, you always talk about a product that you believe in quite a bit, Balance 7. It helps with the acidity in our body. Tell us how this might come into play in keeping our bodies healthy this winter.
So one of the reasons why our body immune system is really not working at top notch or top level is because this acidic environment within your body suppresses that response. By having more alkalinity within your system, it allows your body immune system to function at top level and have the ability to fight some of these viruses. So the supplement we're talking about is just in extremely highly concentrated with pH of 11 too. So it does that. It just go in and just kind of over time slowly helps your body to your immune system to get boosted and fight the multitude of infection, and viral infection is one of them.
Yes, absolutely. I know you believe a lot in this product. You take it every day. We had your founder on last month of Balance 7. That was a fascinating interview. Amazing guy in his 90s. Thank you for this special offer, folks. If you are interested in purchasing Balance 7, Dr. Nooristani is offering 10% off when you go online and you use the code, the special word, AL10. By the way, the founder is Al, so that's where the AL comes from. Dr. Nooristani, I look forward to speaking with you next month, and hopefully everyone stays well from now till the next time I talk to you.
Thank you so much. Stay safe, wear your mask if you're traveling. Thank you.
Thank you for the reminder, and all the best to you and your family. Happy holidays.